Good day to everyone, our BSN 22 students. So we will conduct our synchronous session for today, still with our course Nursing Informatics. As we reviewed our topics that was discussed last time, we have reviewed on how nurses will be involved in nursing informatics through the various careers and opportunities that can be opened for every nurse in case you will be interested to have this track of the career. Second is we also had a discussion pertaining to what are those benefits that we can consider in health informatics. This includes on how we can make the information more meaningful and useful. This can consider the principle itself can consider as a method on how it will facilitate exchange of information and other benefits by which we have considered as the use of the technology on how we process information through barcoding, through the use of the electronic health records. We discussed also I presented also the video presentation in relation to how nurses, in accordance to the University of Texas, will expect uh, certainly the discharge of performance of functions through the expected competencies. And actually, it introduced also during the video presentation the first level, the intermediate level, and the expert level of the opportunities that may open to our nurses, specifically on the nursing informatics. Actually, the topic for today is in relation to the principles on the key points on data, information, and knowledge. This has been defined in our first discussion, and we have some exercises by which we have considered the examples on the clustering, how these terms have been identified into data, information, and knowledge. Okay, noted, Ms. Encina. Now, let's have again an interactive session of why knowledge is important in the nursing profession. So this is an open text. Anyone can share their insights on this. You may type in and visit again the slido.com with the code number 2618955. Again, the question for our interactive session is why knowledge is important in the nursing profession. So you may type in your responses, and we will also ask students to share their responses as well of why they posted those responses and explore on this perspective. We have discussed about data, information, and knowledge, and now I'm asking everyone to share their insights on why knowledge is important in the nursing profession. It has been introduced to all of you that in the for a nurse to be competent as future professional, it always considered the acquisition of the knowledge, the skills and attitude, or KSA. So we have received, it is now, we have one response posted. It solidifies the information that we have given to the clients. So certainly with the term solidifies, basically this considers on the specific information that will satisfy the patient's trust to the nurses, because it is very important, I think, that the information that we are sharing to our patients will also give them the confidence and trust to the nurses and the healthcare team to provide safe and proper care. Okay, kasi the term proper care is very important. The proper care probably considered the appropriateness. Yan, proper care and appropriateness. Because the knowledge itself, and on the other hand, may benefit the nurse and the patients themselves. Because eventually, the proper care that we are referring to is the appropriateness based from the assessment of the nurse. And somehow, the proper care that has been rendered through the knowledge of the nurse will benefit the patient because this will direct to quality, to the measure of quality because of the improvement of health. So this considered, yeah, it's already considered provide quality healthcare because seemingly you are referring on how the nurse will basically consider the use of her learning experiences, just like even as students you have learned concepts in lecture, you have done return demonstration in your skills laboratory, and immerse yourselves in the clinical where you perform to actual patients. So it benefited you as future professionals, and at this time you are already performing it even with those individuals who may ask or have given attention on this perspective. Knowledge enhances skill, yes, because it always consider the to match what you have learned and what you are performing, because the knowledge itself had been considered as our foundation in everything that we do, decide, and consider for our clinical decisions. So I saw a response and referring to it helps the acquisition of skills that are necessary for making better healthcare decisions. So before we have discussed evidence-based practice, because if we considered evidence-based practice, then this consider healthcare decision that will promote safety, and safety of patient is definitely our core responsibility. It identify the health needs of the patient, correct, because the knowledge itself on how you facilitate gathering of this information will identify prioritization of needs of the patient, those that are that could need immediate attention. Good. Knowledge gives us foundation on how we can properly manage our patient, correct? The knowledge and the foundation itself can be associated with each other because these are learning by which it could lead to a perspective that you as a future professional will consider on how you will deal with every healthcare situation, simple or even complex healthcare situations, to make better decisions. So other than the better decisions, so we could consider the best decision as well. So because we weigh sometimes for better decisions, we weigh what is best for the patient, and that could lead to the best decisions. It allows nurses to communicate effectively with patient and comprehend in any issues that may arise. Correct. So probably the knowledge, the knowledge that you may have may help the relationship with the patient through the exchange of information, and thus this will consider cooperation and trusting relationship and rapport among those patients. And it considered here to provide effective healthcare. So the key terms that have been used here is effective because the measure could be the patient leaded to recovery, the patient discharged from hospital without complication, or the patient did not develop complications. So that is eventually effective healthcare. Because if you have the foundation, for example, in on what will be the alarming, or what are those alarming symptoms that may lead to complications. So somehow, to give supportive measures to render immediate care to the patients may lead to prevention of complications. It raised awareness on personal and professional accountability. I like this answer because the accountability itself, okay, the accountability itself matters in every decision that we perform or that we consider, because personal is personal accountability is you will admit mistakes, and professional accountability is on how you will use the standards accordingly to your function. It is important to have knowledge that can give nurses greater power to talk in action. Okay, knowledge is power, di ba? If you've heard about it, this will consider, or this will facilitate change. Yan. Knowledge can facilitate and can embrace others to be more motivated and determined of what they are doing as well for the better healthcare management. So, ayan, we have considered safe and quality. So you always use the safe and the quality, which is good. Provide the best patient outcomes, correct? Yan. Kasi when we use the knowledge, and if you consider nursing care plan, di ba, we always use the information, subjective or objective data that will give us the specific intervention so that we may provide the best patient outcomes. Kaya nga, di ba, when we do planning, we are aware of SMART: specific, measurable, attainable, realistic, and time-bound. And this basic knowledge will direct us to be more focused in our interventions and to achieve the expected outcomes. I am really impressed with your responses. And if you will observe, most of the basic terms that had been associated with these responses, why knowledge is important in the nursing profession, most terms that had been associated, number one, patient, knowledge, and nurse. So eventually, if these responses are good reference of the patient and nurse relationship and knowledge as the core foundation to achieve quality, safe care. So thank you very much for these responses. But probably I may call two students to share the responses of why knowledge is important in the nursing profession. So we are 24 on board, and I may ask siguro Mr. Carl. Mr. Carl Delco, do you want to share your response, or even if you did not post a response, you can share your answer and the question for our interactive session, why knowledge is important, Mr. Delco?
Yun daw po.
Yes po.
So,
So,
yun po, yung
yes.
for mm. Yung knowledge po, this help to communicate properly with the patient, and enables them to understand any problem that the patient is facing.
Mhm.
Nurses po, they need to nurses need to be able to clearly articulate any instructions for patients, like paano po inumin yung gamot, like
Mhm.
paano sila i-reach if may need silang specific na thing, ganun po.
Mhm. Okay.
Ganun
I
po
think,
yun.
yeah, thank you so much, Mr. Delco. With your responses, you focus on how the nurse will definitely perform. Uh, Basically on the how it will protect patients and how it will protect the profession. So thank you very much. So let me call another one po. May I ask, uh, you can raise your hand if you wish to share. You will be acknowledged and recognized. Okay, Miss Coro, thank you so much. You're acknowledged.
Yes, hello sir. Din yung answer ko po dyan, it is vital for us future nurses to be knowledgeable because it can give power to take action
Mhm.
and to provide effective care. And also, it will if the nurse is knowledgeable, it will increase efficiency to take care of the patient or the client, and reduces the risk of errors, and improves communication with the family, the doctors and other nurses. For example po, syempre may mga family po, may mga relatives po minsan yung patient na hindi nila alam kung ano ba talaga yung sakit or ano ba talaga yung dapat gawin. So kaming mga nurse, dahil knowledgeable nga po kami, may explain po namin siya ng maayos para maintindihan po nila.
Okay.
And yun po.
That's good. That's good. Actually, when we considered on the perspective yung how a nurse will take into consideration decision making, you're correct. Kasi you want to share the best interests, and with ethical standards, di ba? Even in health ethics, you always intend to do good for patients. So I think the basic knowledge could be the power that you may have to basically consider this for safety and welfare of our patients. Thank you so much. Miss Galarido Meribien.
Yes, hello po, Dean. So, yung answer ko po is yung it solidifies our actions when we perform proper nursing care. So I'll give an example na lang po. So since kami second year, we do our RLE na. Syempre before po kami mag-perform ng RETDEM, nagpa-practice po muna kami within ourselves. Tapos po parang doon iba-iba po yung nagagawa namin or may na lilimutan kami. Tapos po kapag natuto na kami yung actual RETDEM na, doon po namin nalalaman yung mistakes namin para po kapag in the near future, kapag i-execute na namin yun sa patient, is tama na po yung gagawin namin. Ayun po.
Thank you so much, Miss Maribien, kasi di ba we always do rationalization. The rationalization itself is on how you will validate this information that will fit to the condition of your patient. So I think that could be one. That's why sabi nga ni Miss Coro, it's power. And through that, it validates on how you will decide accordingly. And as rational individuals who are capable of having decisions according to standards. So I think that's one. Okay, thank you very much, Ms. Galarido, for your responses. Actually, we will proceed to the next interactive activity. So the next interactive activity is still using the slido.com, but with a different question. So, why information is necessary in nursing process? So aware naman tayo, di ba, that nursing process is ADPI. We have assessment, diagnosis, planning, intervention, evaluation. Now, since nursing process is part of our function as future professionals and even as professionals, then what could be the most that we will consider? All of these answers are correct, but for you, why information is necessary in nursing process? So we will connect your answers later. So hoping everyone, again, please visit the slido.com and have the code 2618955. Why information is necessary? So these are the choices. We have safety of patients, performance of standards, protection of nurses, and basis of legal functions. And later on, we will discuss some of your answers and explore on the specific reasons why considered the topmost and why the others have not been considered as choices. So let us continue to have your responses so that we could have or we could explore your response. Okay, while waiting for the response of the others, so we have considered here safety of patients. Are you considering that the information is very important for safety of patients in terms of anything or not anything, everything that you perform to your patient will need information that is necessary as a basis for decision. The number two, the performance of standards could be information is necessary because it will give you the foundation that what you are doing is based from the research findings or literatures that will justify and validate your decision. So information po ba ay necessary for the protection of nurses? It's because you need also to take into consideration din ba that everything that you decide is accordingly within the standards because of you want to protect yourselves then in the commitment or rather in committing errors to, or this could be also a prevention to yourselves as well. Or on the other hand, information is important in performing nursing process because it is legally acceptable that we perform and administer those interventions to our patients in the best interest for quality care management. So are there any other answers? So we have 95% and we have 5% for performance of standards. If you wish to share your insights on this, you may raise your hand, or probably we may call students po who can share their response on this. So while waiting, if there's no raised hand to participate, probably will call po. Okay, can we call po Miss Aliana Joy de la Cruz? Aliana, can you share your response? I'm sorry. Can you share your answer in relation to why information is necessary in nursing process? Miss Aliana? Okay, I'm sorry. While waiting for Miss Aliana, let me call other students here. Can we call on Mr. Ritz Fernandez? Mr. Fernandez, can you share anything in your mind why information is necessary in nursing process? Ritz?
Evening po din.
Good
Ano po
evening.
yung sagot ko po is protection of nurses.
Yeah.
Pero hindi ko po nalalagay.
Oo
Kasi
nga,
po
hindi nag-reflect.
Bale, pwede pong yung pasyente po natin, meron po siyang contagious na sakit, tas hindi po natin siya tinanong agad kung contagious ba yun or hindi. Kaya, information po is necessary. Thank you po.
Are you referring, Ritz, na kasi syempre with the basic foundation, you will ask the patient if it's contagious or not. Di ba seemingly tayo yung mas nakakaalam if the condition is communicable or infectious? Are you referring that if we will ask the patient if her case or his case is infectious, and the nurse must be aware if it is on that level or health status? Am I right, Ritz?
Yes po, kasi po, di ba po, di minsan yung iba pong pasyente, tinatago po nila yung sakit nila. Tapos po,
Okay.
bigla na lang po makakahawa, ganun po.
Okay. So probably you are referring to a situation by which the client must divulge the information so that it will protect nurses, and those information are necessary. Siguro that the example with that is when you are doing your patient history, and when you're doing your patient history, and if the patient did not declare the necessary information, and yun pala you have been diagnosed with an infectious disease or communicable disease already, so that will risk the nurses in those situations. So tama ba, Ritz?
Po din, yun po.
Okay, thank you. So I will acknowledge
din po.
Thank you. I will acknowledge the response of Mr. Carl, identifying the client's current or projected healthcare concerns or needs to develop plans and address the identified requirements to provide particular nursing interventions in response to their needs. All of your answers are definitely correct, Mr. Carl. Thank you very much. So I see a raised hand. Yes, Richmond De Leon, you're acknowledged.
Ayun. So, ang sagot ko po dyan, why information po is necessary in nursing process po is yung either ano po kasi ang sagot, ang pinaka-priority sagot ko po is yung safety of patients. Kasi po, di ba po when we define information, ito po yung mga knowledge na sinishare or in-obtain natin through study or ayun po, through study. So, yung word po, kasi as nurses, yun yung pinaka-top priority natin na kailangan gawin is that we need to ensure the safety of the patient. So how we can, so by using for the information that we have, we collected or we obtained po from them, we can perform po yung nursing process correctly. And yun po, yung second answer ko naman po dapat is yung performance of standards. Kasi ano nga po, bali nga po, di ba nabanggit niyo po kanina na when it comes to performance of standards, information po will be the foundation. So, yun po. So, parang either of the two po yung sagot ko.
Thank you so much, Mr. De Leon. Very clear response. So, I told you all of these choices are correct. That's why you are being asked of what would be the best response that you may do. So this is somehow the same of what we are doing in the nurse licensure examination. All are correct, but choose the best answer. So I see a hand from Miss Era Pegarido, then to be followed by Miss Coro. Let's have Miss Pegarido.
Yes, good evening po, Dean. Kaya po siguro for me safety of patients kasi without information hindi po tayo magkakaroon ng assessment which is the first step of the nursing process, and without this thorough assessment hindi po tayo magkakaroon ng diagnosis, and without this diagnosis hindi po tayo makaka-develop ng care plan, which is yun naman po yung number one goal natin as nurses, to give care to our patients. So very important po yung information. Ayan po.
Very good. Very good. So again, it really reiterates that knowledge is power, information is important and significant. Thank you. So let us call again Miss Coro.
Yes po din. So my answer po dun is patient safely rin po yung number one. Para
Mhm.
sa akin yung fundamental to deliver quality essential health service po talaga is patient care. Saka kung mag-start po tayo na parang siguraduhin safe yung patient natin, hindi tayo po magkakaroon po tayo ng performance of standards po eh. Parang susunod po dun performance of standards, then masusure po natin na yung protection ng nurses kasi hindi tayo magkakaroon ng errors. And then hindi tayo mapupunta sa basis of legal function po. Pag iuna po talaga natin and yung safety ng patient po natin.
Thank you so much, Ms. Coro. That is definitely correct on the perspective that safety, kasi yan talaga ang emphasis natin, safe and quality nursing care that will consider the successful achievement natin to every nursing process and meet the standards as well for quality care management. Thank you. Yes, Ms. Galarido, you're acknowledged.
So, Dean, my answer po is safety of patients. Now, ipapasok ko po dito yung sa bioethics po namin na Code of Ethics,
Yeah.
where na necessary po ang information kasi bawal po na kami magde-decide kung what kind of nursing care yung ibibigay po namin sa patient. So, parang sunod-sunod po yan na meron kaming step-by-step na dapat gawin para po mabigay po namin yung proper nursing care and para po ma-develop po namin yung welfare ng mga patients. Ayun po.
Good. That's good. Yan. Kasi the exchange of information matters when we are considering the needs kasi, and that prioritization of needs is very relevant. Thank you so much. I will acknowledge naman the response of Ms. Conwy. Napili ko po din is yung safety of patient kasi po like example, pag nag-assess po tayo kay patient, kunin po natin yung identity and client's health status. Very good kasi, for example, if you will administer drug, di ba, I even discussed to you before the rights of medication at isa doon ay right patient. So kung for example, data kasi yung patient yung name of patient. But you need to consider the name of the patient so that it's safe to administer the drug based from the doctor's order or the treatment regimen. So very basic yon. Information, the name of the patient is an information that will really protect you on and the patient as well, that you are administering the drug appropriately for that patient and considering the appropriateness of the drug to her or to his diagnosis. Thank you very much, Ms. Conwy. So are there any other insights, any other students who wish to share their insights on this? So seemingly in these exercises, information is necessary in the nursing process because we are aware that safety of patients, and it's good that you have already the background in your health ethics because it is very important for us to take into consideration now that information, knowledge are very important in our profession. So hoping that you have learned in our 2 interactive session. Now we will proceed on our review of what data, information, and knowledge is. Kasi when I primarily discuss what data is, when I mentioned about 37, okay, many of you answered many definitions, or you have associated it with many meanings. So that's why kasi pag ang data kasi natin are terms or numbers that may have many meanings ito, because it has not identified. It could be kaya if we mention observations, these are not validated. Yan. So that's why one of the example, name, data yan. These are name, address, past medical history, past allergy or history of allergy. So those are data, because you really need to gather information. And once you fill this data, then information now matters, because it answers already the meaning of who, what, where, when, why. So this particularly consider the importance of why nurses really need to have the right information. Kasi this matters on how we considered, sabi natin kanina, safe and quality care. Now, the knowledge comes in as an important factor, because you will now validate and justify that based on the data and information, it will be more meaningful and useful for the patient. Kasi kung for example, you have the data, di ba, subjective data and the objective data. So you have gathered it with the information. So you have now the information. You can now proceed with your planning, wherein it answers the who, the what, the where, and the when, and why. So we can now rationalize the appropriate interventions that we may consider for the planning and intervention, and how this could be knowledgeable. The knowledge itself. The knowledge is that of for a nurse who can justify, the nurse who can validate, a nurse who may have high confidence that I chose and I considered the clinical decision to have this intervention. It's because it is based from the knowledge and the data and information that had been gathered from the patient. So it matters. So that's why even nursing process is very important on the data, information, and knowledge. Now, to proceed with our discussion, I will present to you an audiovisual presentation by which it will consider the what we call DIKW pyramid, so that we could have more understanding of what data, information, knowledge, and wisdom as well. Let us watch.
The DIKW pyramid is an example of a simple model used to help us understand a more complex topic. It is also very relevant for data analysts to know and understand. The DIKW pyramid is used to help explain understanding, as we go through the evolution of working with data to transform it into information, knowledge, and eventually wisdom. In this manner, we develop a better understanding of the structural and functional relationships between data and wisdom. At the base of the pyramid, we have data. Data is very abundant, but it is also relatively meaningless. Data consists simply of raw values or measurements. Information is the next step up in the pyramid. Information consists of data with the addition of context. Context is supplemental data that provides meaning to the original dataset. This can be information such as who, what, when, and where. Notice that data and information are often objective in nature. The third step in the pyramid belongs to knowledge. Knowledge is information with the addition of experience. Experience can be gathered secondhand through studying books, such as in college. Experience is also accumulated firsthand from life and work experiences. With knowledge, we are now incorporating subjective expertise, as different people will have different experiences to shape their understanding of information. At the narrow top of the pyramid, we have wisdom. Wisdom is knowledge plus the addition of action. Wisdom determines what we do, or do not do for that matter. Wisdom is also subjective, as it depends on our interpretation of prior knowledge. When we step back and reevaluate the entire pyramid, we notice another trend that separates the tiers. Data, information, and knowledge are all established in the past, whereas wisdom is used to establish forward action. Wisdom is future-looking, while the others are backwards looking into the past. As you move up the pyramid, you'll also notice each tier has more value than the tier before it. The inverse of that is as you move down the pyramid, the tier below has decreasing meaning. As an example, information is more valuable than data, as data has less meaning than information. Context distinguishes information from data. This concludes the DIKW pyramid model. Using this simple pyramid model, it should be easy to see how a lot of information can be conveyed using a simple graphic model.
Okay. If you notice, in this DIKW pyramid, it already considered the basic concepts that I have introduced to all of you. That's why when we said the example on data, information, and knowledge, the data itself, it was reiterated meaningless because you cannot specify the use of the term accordingly. So that's why it's raw values of measurement. On the other hand, for the data to have a higher level of specificity, that's why it translates into information if we will try to consider its context. Kaya nga, as what I've told you, for example, 37. So 37 could be age, 37 could be temperature, 37 could be number of patients in the ward, 37 could be number of public health nurses serving the community. There are many meanings that we can associate with 37. But if we indicate in the information on the context that 37 degrees Celsius, meaning it is specifically on the context that we identify it what? What? Because it refers to temperature. Now, if the 37 degrees Celsius is considered now as an information, how it translates into the knowledge? It's basically on the mentioned experience. So, di ba sabi natin, it translated into knowledge because it is mentioned that the 37 degrees Celsius is a normal body temperature. 37 degrees Celsius when you encounter patients in the clinical areas and 37 degrees Celsius is normal, then eventually you recorded it as a normal temperature as based from recording. So that is what we call based from the experience. That's why even in our curriculum, we have considered the acquisition of the knowledge not just only on the base lecture, but we considered it also on how you will develop the knowledge and translate it into psychomotor skills. And other than that, this will add to your confidence to translate this knowledge and reinforce it in the performance to actual patients. So those experiences from the lecture, skills laboratory, and even up to the clinical will have considered the validation, and it is based from your experiences. Now, the wisdom, as mentioned, from yung past, knowledge, information, and data is from the past. And it considered po yung wisdom as a future. Because wisdom na, it is in your capacity na by which you will weigh and decide accordingly based from knowledge, information, and data on how you will use this in your future. For example, what you have learned in what you have learned about fundamentals of nursing practice in your first year level is useful when you encounter concepts of OB and pedia because the basic procedures applies to this population group. So meaning, have you maximized the use of your knowledge based from what you have learned in your first year level? The answer is yes. And this could be validated through formative and summative assessment. So if ever you have decided accordingly that 37 degrees Celsius, you recorded it and documented it as normal, and definitely continuous monitoring must be done if there are changes that will lead to the deviation of the temperature, that now you are using it now as a wisdom because it's a higher level that you're using it in your own clinical decision making. So for now, it's we have the time check. It's 6:40. We will have first our health break, and we will have it 15 minutes. And after 15 minutes, we will resume our discussion. So you may hydrate yourselves, attend to your physiologic needs, and you may empty your bladder. And we will be back after 15 minutes. Thank you. So it's already 6:55, and I think we have exhausted the 15 minutes that we have for our health break. Let us continue with our discussion. Um, as we continue with our discussion, let us now just have a review of what data, information, and knowledge. So as what we have mentioned, these are terms, numbers, symbols. So examples that we have is 98.6, 59, female. Very generic. Very generic. So we don't know if 98.6, again, it's a number. 89 again is a number. It can be associated with anything, so it's meaningless. Although female, we can identify it as a gender, pero the female itself is associated with what? Female what? Specific profession. Female specifically what age group or population group. So still, if we can't answer a certain term, number, or symbol, then that leads to a data. Now, if we consider it as an information, which we have mentioned that it answers the 5 W's. So if we considered 98.6 as a normal temperature reading, then this must at least consider if it is Celsius or Fahrenheit, because it will give us the idea if it's already a deviation or a problem with the body temperature. And we all know if it is Celsius, it has a different meaning. And if definitely Fahrenheit, so probably 98.6 Fahrenheit. And if it's 98.6 degrees Celsius, let us think about it if it is a valid information. So I think if we are talking about the normal temperature reading, the 98.6 is definitely degrees Fahrenheit. So it matters that the value itself of putting another identifier to this to data will give us the right information. As what we have mentioned, if 89 will be with the pound or with the kilogram, or if it is linked with years old, then we could identify it as an age or a weight specifically. So for the female, if we are just considering a gender, so it answered the data as a female alone. Now, when we are considering the point of the theory and its connection, it is very important for us that the data, information, and knowledge are interconnected with each other, because the clinician refers to our profession as nurses. The healthcare intervention refers to how on what measures that we have done to our patients, and the patient outcomes refer to the results of care management, and the problem itself is the issue or the health issue that had been identified. So these are very important, the theory and connection on how the nurse is connected with the specific information needed for health interventions, and how the nurse is connected with the patient outcomes. Kaya that's why this is simply on the principle of nursing care management or nursing care plan. If we did not meet the patient outcomes, then we need to revise the care that we have rendered. So there's something that there's somehow an information that is needed to support the efficient and effective way to have the results as based from the plan. So let's have an example in the real world. Let us ask if this is a data or an information. A public health nurse visited a high-risk pregnant teen with substance use problems who needed health care. Let us go back to the concept of theory and connection: clinician, healthcare intervention, patient outcomes, and problem. In this scenario, we have identified the clinician already, the public health nurse. Okay, so we are just applying the principle of theory and connection. Next, let's go back again. If we are referring to the patient, okay, the patient, high-risk pregnant teen. Okay, so patient. So substance use problem is the identified health problems. If we will try to go back, so that is the problem, and the needed health care is the one that we are referring on the intervention. Now, let us proceed to the next slide. In the next slide, this is now the theory, okay, and how we will connect it with the basic principle of data and information. Example, a public health nurse. A public health nurse could be a data ba or an information. Could be considered high-risk pregnant teen as a data or information, substance use problem as a data or an information, or needed healthcare, is it a data or information? The more specific the more specific meaning that it will answer the 5 W's, the more that we gear towards that these are information. Example on this, as to best explain this, for example, ang high risk pregnant teen could be considered as an information. Why? Kasi ang data niyan ay demographic data. If you're aware of demographic data, ang demographic profile ay ang consideration natin diyan is yung ano yung status, ano yung specific health status of the patient, what is the age of the patient, what is the classification of the patient as according to diagnosis, yun ang demographic data. Why high-risk pregnancy is considered as information? Information siya kasi it answers that the health situation, the person is pregnant. It specifies the answer din na high risk siya. Tapos the teen is specifically the age group, teenager. So, di ba, in the specific age group, we can identify teenagers. So, I think the high-risk pregnant teen as the patient is specific, and that concerns with information. If demographic data, demographic data, very generic, you need to know more what is the profile of the patient. That is demographic. But if it answers in the situation high-risk pregnant teen, ay information yan. Even with the clinician. Okay, clinician tapos public health nurse. Which of the two, clinician and public health nurse ang information? Can I see a response or answer in the chat box? Which of the two is considered as information? Clinician or public health nurse? You may type it in the chat box. Now, again, my question is that of public health nurse. Is it an information or a data? Public health nurse, is it an information or data? You may type in your answers in the chat box. Okay, I've seen one response, information. Okay, public health nurse. So, ang sagot natin is the public health nurse. Ayan, kasi iba pala yung question ko kanina. Which of the two is information? Public health nurse or clinician? O sige, i-retract ko yung, I will retract my question. Is public health nurse, which of the following is a public health nurse? Information or data? Okay, you may type in your chat in the chat box. Public health nurse. Okay, continue. Public health nurse, is it a data or an information? The more specific, the more that you will consider it as information. Kasi example kanina dun sa example natin clinician. Ang dami, pag sinabi natin clinician, it will proceed to of all the clinicians that we have, what specific clinician are they referring to? So nagiging data na siya, di ba? Pero pag somehow it will specify the profession, ayun, doon na siya nagiging information. So I think I have seen responses, hoping everyone will also respond in our chat box. So the answer is ang public health nurse is information, because yan I see a response na, as according to Miss Era, public health nurse is information because it specifies as to what kind of nurse. Very good. Aside from it specifies what kind of nurse, it specifies also what type of clinician is referring to. Okay, so nakikita nyo na yung difference between the data and information. Next, problem terms. So yung problem terms dito, ano yung health problem? So ang health problem is, pag ikaw nagpe-patient history ka, what is the health problem? What is the chief complaint? Data siya. So pag nagtatanong ka, data yun. But if we specify na substance use problem o specific siya, substance abuse, that becomes an information. So, now, healthcare intervention. So sa healthcare intervention, needed healthcare. Etong needed healthcare natin is, ano yung intervention? Needed healthcare. Eto may somehow, meron pa tayong ano dito eh. Meron pa tayong dilemma dito. Kung ang needed healthcare ay information o data. Okay, can I ask the consensus of everyone? Ang needed healthcare po ba ay information or data? Needed healthcare. Needed healthcare. Is it information or data? Needed healthcare. We've identified the problem, substance use problems, but it identified needed healthcare. Is it information or data? Okay. So I have received a response na. How about the others? Isa pa lang ha. I have received one response. Okay, continue. Needed healthcare. Is it data or information? You can connect you can connect the relationship with each other kasi you have identified na yung health problem eh. Okay? So I just only received 2 responses. Ayan, 3 responses na siya. Okay, ganito. If for example, the substance abuse is specific tapos needed healthcare. Okay. Needed healthcare. So, what specific need? What specific healthcare? O pag kayo nagpa-process kayo in mind na, yan, data, what kind of healthcare that is needed. Very good. That is exactly Ms. Coro that I'm emphasizing. Kasi the more that you will formulate questions, more questions as well, nagiging data siya. But the more it satisfies you that you will not anymore ask further questions, dun siya nagiging information. So that's why it's data. Okay? Sige. Good. I think data because it is general po, especially the health problems is substance abuse, supposedly what type of healthcare that connects to the substance abuse. Kung for example, rehabilitation, o di ba rehabilitation rehabilitation and isolation. So specific siya, nagiging information, pero yung needed healthcare very broad, very generic. Okay, that's data. So let's have another example on this po. Okay. A critical care nurse attends to a pediatric client with congenital defects that may need immediate care. Okay, that may need immediate care. Now, let us now proceed. Highlighted, pediatric client, congenital defects, need immediate care. Is it data or information? I will now be showing to you this one. Okay, now, if we will try to identify demographic data, we have identified, di ba, in general, yung even though we may not consider pa the age, but at least aware tayo yung range of age ng pediatric client. So ang pediatric client, kasi pag sinabi mo lang client, ay data yan. Siyempre, it's not specified kung elder ba siya, anong population group ba siya, pediatric population, elders ba, adolescent ba, adult ba. So, nandun tayo sa ganung perspective. So, ang demographic data dyan is basically, nagiging information siya, okay, pediatric client. Yan. Pero if we want to dig more na maging information siya, pwede pa natin i-dig siya na specifically na i-consider pa siya kung anong age group, kung anong client siya. Okay. So, in this situation po, there are questions like congenital defects. O di ba ang daming congenital defects? Okay. Anong congenital? Although it identifies congenital, that could be brought about by a certain cause. Pero ang daming congenital defects, di ba? Hindi lang naman heart ang congenital eh. So pwedeng ano siya, pwede siyang cerebral, pwedeng heart, pwedeng cardiac, pwedeng skeletal, o di ba? And need immediate care. So, yung need immediate care, anong immediate care? So, doon tayo pumapasok ngayon. However, the pediatric client, pwede pa natin ma-consider yan as information kasi the pediatric itself is specified among the client groups. Okay? The client groups. Yung congenital defects, it could already identify as a problem term. However, what congenital defects? So kung in-identify congenital heart defects, okay, that becomes an information. And even though in the data, emergency intervention need immediate care. So hindi pa rin tayo satisfy in the perspective na yung need immediate care, di ba? Need immediate care. Kasi emergency interventions need immediate care. Ano yung immediate care dun sa problem na may congenital defects? So now you are learning, on how you will classify accordingly yung information and data. Okay. Now, to continue, let us now define etong mga terms na ito that are very useful in the processing of information and knowledge. Actually, we have semantic tools. Okay, semantic tools. This helps transform or convert data into useful information. Meaning tools. Tapos, if we use the term semantic, relates meaning and language. Okay, tingnan natin an example. Anong mga semantic tools ninyo na wherein once you type a term, it will give you meaning? Anong mga semantic tools ang pwede ninyong gamitin para to support na yung data nyo maging useful information? Can you give an example? Bigyan ko na kayo ng example that could be a web link. Yan, that could be a web link, a website, a web source. Yan, mga semantic tools ang tawag dyan. Kasi, for example, even in your Neo LMS, kasi 'di ba, if you search for a specific menu of the Neo LMS, you will just type in search. Semantic tools ang tawag doon. Dinadirect na kayo mismo doon sa specific area or meaning or specific area or specific portion of that platform. Another example of semantic tools, Google. Kasi once you type sa Google a term, it will already give you an array of meanings. It can associate with meanings from thesaurus, from dictionary, from Wikipedia, from other legitimate sources. It will already have the array. So ang tawag doon semantic tools. Ngayon, yung meaning that the semantic tools are providing, that is what we call semantic. Okay. So, can you give other semantic tools that will guide you to search for meaning of every term? Meron ba? Other than, so okay, we have the Yahoo, the Google, the wherein we could have yung search. Kasi pwede rin ito na mga applications. Yan, applications that you can upload in your you can download in your mobile phones. Yung separate siya na pwedeng what do you call this? Yung pag dinownload mo kasi siya sa mobile, it may not need active connectivity. So yun yung mga tinatawag natin ng mga built-in applications that may not need any more connectivity sa internet. Yan yung mga thesaurus, dictionary na mga applications that will give you meaning, and once it supplement you a meaning, yon nagiging yung binibigay na yon na information through the specific term is semantic because it relates the meaning and its relationship. Okay, so okay, Photomat. How about with the Photomat? What is that application? Is that an application or a website? Can you elaborate it more, Miss Galarido? It's an application. So if it is an application, when you indicate a term and when you type a term, it will supplement you meaning. Tama ba, Miss Veribien?
Din more on po siya, mga formula po pala, sorry.
Okay. Formula, but the formula, once you type yung formula, it will give you information kung anong formula yon. Or kung for example, kung anong formula yung hinihingi, it will supplement the formula. Tama po ba?
Yes po, like kunwari po may ita-type in niyo po dun yung problem po ng question tapos ipapakita po dun yung solution and kung paano po nakuha yung answer. Ganun po.
More comprehensive ha. More comprehensive. That could be one. So yung Photomath, yun yung semantic tool. Yung sinusupplement sa na answer, ang tawag doon semantic. Okay, clear? So let us now proceed. On the other hand, if we say controlled vocabularies, okay, pag sinabi natin controlled vocabularies, ito yung mga words that are universally accepted. Na once you encountered it, alam kong ibig sabihin yan. Okay, a typical example, pag control, words that have already definition, even though it is represented by codes, alam mo na by definition, alam mo na yon. O an example, RX. Familiar kayo with RX. That's prescription. Di ba? Another term, PID. Alam nyo yon, di ba? 3 times a day. So, pagka binanggit natin na what you call this? If we say, if we use a code such as what are the other codes that we can use? NPO. So, ibig sabihin, nothing per orem. Aware na kayo doon. So, other codes dito is yung, meron tayong, if you will search ito sa Google or any search engines, meron tayong tinatawag tayo na international codes. Kasi di ba, sa data privacy, if you are sharing information, there are some instances na, for example, may mga risk din kasi na pag, for example, if the nurse is using the computer at open siya, tapos naka-indicate doon yung diagnosis of the patient, pero kung nakalagay lang doon yung code, any layman na makakakita doon may not identify the diagnosis of the patient. Even the patients themselves gumagamit ng coding para to consider yung data privacy and confidentiality. So, if you will try to search, ano po yung ibig sabihin ng ICD-9? ICD-9-CM. That is definitely a diagnosis. That is universally accepted. Kaya somehow, you need to, if you will try to search po yung tinatawag nating ICD, na ang ICD po ay, ang meaning po niyan ay International Code. Yung ICD, ang ibig sabihin ng ICD is International Classification of Diseases. Okay? So, yung International Classification of Diseases ay ito po ay ang pinaka-updated na version, kasi ang nilagay ko pa ditong example is ICD-9-CM eh. Ang pinaka-updated ngayon po na International Classification of Diseases ay yung ICD-10 na po. ICD-10-CM. Yan na po ang international code source. Kaya, for example, these are being used sa ang Center for Disease Control and Prevention or CDC in the US, kasi ang International Classification of Diseases, dahil nga we use codes, this will identify specifically dun sa code na ginagamit po natin. So probably if you will try to search this, kung ano yung mga international codes, kasi kung for example, ano po ang international, ang ICD code for ICD code for ano mga example natin? Sige, magbigay tayo ng example. Ang ICD code for tuberculosis. International code for tuberculosis. Ang international code po for tuberculosis is Z11.1. Okay. So pag sinabi mong C11.1, okay, C11.1, alam nyo na, tuberculosis. Pag ginamit yung code na yon. So, this is another trend that you really need to review, or if you will try to search yung international diseases, international code of diseases. These are universally accepted and these are being used to data privacy and protection of patients. And these are also used when processing information, lalo na pag nagpa-process po sa insurance. Yan, they are using international codes. Okay, so these are controlled vocabularies. Now, let us now proceed to taxonomies. I know familiar kayo sa taxonomy. Pag sinabi nating taxonomy, it defines terms and interrelationships. So ano ba yung mga example ng taxonomies? Kasi di ba, for example, science, or rather ano lang, a nurse. So ang nurse on the top, di ba ang nurse magba-branch out pa yan. Pag nag-branch out pa ang nurse, ay pwedeng by specialization, di ba? Nurse on emergency care, on critical care, on maternal and child care. So, yung taxonomy mismo, nagba-branch out siya because it specifies from the top as a general to specific, and it will show relationship. Okay? So, an example po, ontology. Yung ontology for population. So, meron ba tayong basis for the ontology? Ang ontology po ay ginagamit po ito. Ano po bang ibig sabihin, sir, ng ontology? Ang ontology is a study wherein it considers the branch po ito para i-categorize ang ating ang mga terms on its cluster or its own properties. Kaya sinabi natin, if we say a nurse, anong nurse? So it will identify critical care nurse, emergency care nurse, maternal and child nurse, home care nurses. So yon, nagbibigay siya ng very specific information, and it will show relationship. So ano yung common doon? Ang common doon, all nurses. Kung sinabi ko lang emergency care, maternal and child care, home care, these are the types of care rendered, the care services rendered by nurses. I can now relate to it kasi it branched out through the use of taxonomies and ontologies as well as it will use the relationship. Okay, now, pag sinabi naman nating interface terminology, yung terms dito are terms that facilitate direct entry of information into a computer. Okay, ito yung interface terminologies, ito yung, di ba, for example, when you are asked to register into a webinar, ano yung mga nakalagay dyan? Nakalagay dyan ay name, profession, age, yon, data pa lang yon. But once you enter yung information directly to that online form, interface terminologies po na yon. Now, simple, use of electronic health records. For example, if we manage to enter the data into the hospital information system, example in the emergency room, you are facing the computer, you have already the system, or you will enter the basic information of the patient. Then afterwards, what is your physical assessment findings? You will just tick those findings. For example, there's a deviation in vital signs, hypertensive, there's hypertension, the patient has fever, the patient is having bradycardia. So it will just tick. So once you facilitate the entries of information into the system, that is interface terminologies. Now, when we talk about reference terminologies, ang reference terminologies is a set of concepts that provide common reference point of comparison and aggregation of data. So, sir, simplified it. So, ganito. Ang reference terminologies po ay, di ba, in research, we use citations. Yan, yung mga citations. For example, sabi ko, a set of concept, reference terminology, the set of concept of relationships. Sir, saan galing yan? Anong reference mo yan? The reference terminology is provided by the specific citation. The citation is either coming from web sources, coming from books. Ayan, coming from books. What are the other sources? Coming from journals, coming from the specific even individuals. Yun ang tinatawag nating reference terminologies, wherein yung set of concepts, we can set point of comparisons by the data itself. Another reference terminology, pag nagbibigay to ng analysis, example, vital signs 37 at 8 o'clock, tapos 12 noon, it's 38. Nakita na when you search it in the system, nakita mo yung increase in the graph. Ibig sabihin, there is an increase in the graph, it shows that there's change in the temperature, and it shows na nakita mo doon naka-red, the color code itself is deviation deviation from normal. So ibig sabihin from that color code pa lang, tapos nakita mo pa lang yung graph na tumaas, ibig sabihin I need to take into consideration the intervention that I must do because it alarms me from that representations pa lang. Okay, if there are questions, please don't be hesitant to put it in the chat box. Okay, next. Ano naman yung interoperability standards? Pag sinabi natin interoperability standards, pumapasok, it will now consider now yung sharing, exchange of information. Example, I enter the information in the as a nurse in the what you call this? I enter the information to the system. Now, the doctor can access the information. The nutritionist can now access the information. The other healthcare professionals who have the viewing rights can access the information. And the doctor now had the input of his orders for pharmacological and treatment regimen. Nag-exchange, and here comes the nurse who can now view the orders of the physician and carried it out to the patients. So if there are already exchange and sharing of information, that is interoperability standards from the term itself, inter. Okay? Yung term kanina that we mentioned is that of yung interface terminology. If we initiated pa lang yung entry of information to that system, interface terminology. Pero pagka interoperability standards, that is now the information that you have entered to the system can now be accessed with other individuals. So now, if we're considering the informaticists, I think this is the one that is being emphasized as well on the position if you will engage yourselves into the perspective of having your careers in health informatics. The informaticist is the one that will generate this data into knowledge, data, information, and knowledge, and how this could be useful for our nurses. If kung ang ang data po as an interpretation and analysis, just a typical research, kasi di ba sa research you pag sinabi nating data gathering, okay, you have the data. What are the needed information? Then now you retrieve those data. You did those information coming from respondents. So may data ka, may information ka. If this information will translate into analysis, doon na siya nagiging knowledge because it gives us a deeper understanding of what information had been gathered through the process itself. So that's why there are threats naman. Ito na yung mga threats Pag sinabi natin threats to data interpretation, meron din kasing mga things that we really need to take into consideration na we must be very careful in the interpretation. Kasi we all know, pag sinabi natin semantic equivalence, may mga situation that we really need to take into consideration sa layman at ibang interpretation ng nasa allied health. Kasi if we're considering healthcare professionals have diverse vocabularies and perspectives. Kasi for example, for nurses and doctors, we could be connected with each other because very common ang language natin. Pero pagka ang ibang health professions, gumamit sila ng ibang standards when it comes to the codes they are using, ayun, doon na tayo nagkakaroon ng problema. So example ng semantic equivalence, example, elevated blood glucose, high sugar. Okay, anong interpretation nyo dito? Pag elevated blood glucose at high sugar, which of the two ang clear sa inyo dito as healthcare professional? Is it elevated blood glucose or high sugar? Pag we are dealing with healthcare. Anyone, you can raise your hand. Which of the two, pwede ba magkaroon to ng pwede ba tayo magkaroon ng high chances of misinterpretation dito? Kasi for example, kaya in layman sasabihin, ay mataas yung sugar mo. O ano kaya yung sugar referring to? Pwedeng hindi naman niya binanggit sugar ba sa dugo ito o sugar sa content ng food. So yun yung mga possible risk dito. But if we consider elevated blood glucose, very obvious, the term itself elevation is increased. Blood is referring to blood, obviously, and the glucose, we are referring to the sugar level or the level of sugar doon sa blood. So, clear tayo. Pwede sabihin natin, elevated blood glucose, hyperglycemia ito. But if you use the high sugar, ito sa layman, nadidinig nyo yan eh. High sugar. Mataas ang sugar mo. Naku, ano kaya yun? So, doon na tayo, yun yung tinatawag nating semantic equivalence. Another, hypertension. O aware kayo, di ba, sa hypertension? Technically, as health professionals, aware kayo of the diastolic and the systolic so that it could be identified as hypertension. Pero I know for a fact na pagka sinabi natin for a layman, dun sa mga kumukuha na hindi sila trained, although they interpreted it, for example, interpreted it, mataas yung sa heart mo, mababa yung sa dugo mo. May something that we really need to talk about. Doon na tayo nagkakaroon ng perspective, kailangan po ito ng further education. Kasi pag sinabi mo, for example, ang nakuha niya is 140/90. Yung 140 mataas, ayan sa puso yan, mataas yung sa puso mo, yung 90 okay naman yung sa dugo mo. Class, doon sa mga ganong interpretation na nadidinig ninyo, dapat kailangan natin i-educate pa more because this will cause a misinterpretation kasi the whole itself, the blood pressure itself, systolic and diastolic, is the pressure created within the heart itself, within the blood vessels of the heart. Kaya connected pa rin si heart at si blood. Hindi natin pwedeng i-separate yon, si heart sa systolic at si diastolic is only referring to the blood. So those are the situations. So eto na, so for the yung kanina na minention natin ay semantic equivalence. Na somehow pag sinabi natin ito, parang the same language lang. Pero pag sinabi natin kasi semantic gaps, data may not fully represent meaning but result sa large gap. Example, elevated blood glucose. So ito na ngayon, what is the patient's typical blood glucose? What did the patient eat or drink? What medication is the patient taking? Kasi pag elevated blood glucose, ito na yon. We are more focused to know specifically yung mga related questions and appropriate questions that we will give to gather the specific data. Kasi sa atin sa health professionals, mataas po yung blood glucose ninyo. Kayo po ba ay diabetic? Ano po bang last na kinain ninyo? Mataas po ba sa sugar content? Ano po bang usual blood glucose level ninyo? At what medication? Kasi these are the things na pwedeng mag-trigger to the increased blood sugar level. So I think I ended up with my discussion on what could be the semantic equivalent or rather the semantic gaps. So I will end the recording.